Hello, everyone. Welcome to the Curious Minds Expanding Horizons, Discovering the Potential of Medicaid. I think we're shutting the doors here, so we're going to get started. Let me know. You can just wave at me if I'm going too fast. That's totally fine. I take that kindly. And also, if you have any questions, we're going to try to keep as many of the questions to the end as possible. If you have ones you're thinking of when you're on a slide, go ahead and write it down. We'll revisit it. But if you have any urgent questions that you just know you're not going to remember, feel free to go ahead and put your hand up, and I will take opportunities as I'm able to call on people for questions. So I'm going to go ahead and introduce myself first. So my name is Kyle Novak. After I introduce myself, I'm going to hand it off to my co-presenters here, who you may recognize, at least Rosie. Congrats on the Die Hard Award. My name is Kyle Novak. I am a program and policy analyst with the Department of Health Services. I write policy for the IRIS program. So IRIS is kind of my expertise in my realm. We will talk a little bit about other types of Medicaid and long-term care programs like family care, for example, very briefly. But IRIS is kind of where we're going to end up at the end. So I write policy, but I've done a lot of other things too. I've been in long-term care for about 11 years. I've done various different things and had different roles, from being a PHW and providing direct care all the way to running residential facilities and writing policy at the state. So quite an array of things I've done. But I'm gonna hand it off to Kathleen and then Rosie.
Hi, my name is Kathleen Belgin. I'm a provider field rep with Forward Health. I've been with Forward Health for about 8.5 years now. I've worked anywhere from the call center, I've worked in our PA department, and now I'm a provider field rep. I have to go close, sorry. Okay, I'll start over again. This is my first time doing this, everyone, so please, patience is appreciated. So I'm a provider field rep with Forward Health. My name is Kathleen Belgin. I've been with Forward Health for 8.5 years. I've worked in the call center on both member services and provider services side. I've worked in our PA department, and now I'm been a provider field rep for 2 years. So I'll hand it over to Rosie.
Hi, everyone. My name is Rosie Bartell. I am a participant in the IRIS program. I use several different services in the IRIS program. I've been a participant in the program since 2016, and I have been on the IRIS board, advisory board, since for the last 3 years. And I've just said I'm going to opt up for the next 3 years, so I will be with them another 3 years. So, but I have a little bit of a story to share a little bit later. But you know, I feel very strongly about what we're going to talk about today, because I think many times we're confused about what are the waiver programs, how does that Medicare and Medicaid work, and why do we have two different cards, and why do we have this, and why do we have that? And so I'm hoping that we can answer some of those questions today for you.
All right, thank you, Rosie and Kathleen. So as they said, we're going to have a couple different spots where they'll jump in and provide some really helpful context. I'm just here as information today. You can think about me as information and questions. All right, so I bet you're all wondering, oh, hold on here. There we go. What will we learn today? So what are we going to talk about? One of the first things we're going to talk about is introduction to Wisconsin's Medicaid system. What is Medicaid? How is it a state system? How does it run? What does that mean? How do I access services? That kind of thing. We're going to talk about the differences between Forward Health and card services. That's the Forward Health card and or card services, Forward Health card, that kind of thing, and long-term care services. That's the waiver services you might know as IRIS or family care, and how they play into each other. We're going to talk about the differences between long-term care service delivery models. You may know family care as managed care, or heard of managed care. You may know of, obviously, IRIS's self-direction we're going to talk about too, and kind of everything in between. What's the in-between options as well. So we're going to kind of back it up a little bit to the highest level that we can. And we're going to talk about the differences between Medicare and Medicaid, and what those, how those play into each other, and what that means for Wisconsin residents. So Medicare is a federal insurance program for people who are 65 and older or who have certain disabilities or conditions. Medicaid is a joint federal and state program that covers healthcare expenses for people with limited income or resources. Now, the big things you're going to take away here and that we'll talk about and emphasize on the next slide is that Medicare is federal. It's federally run, federally managed. It's a federal program. And it's for 65 and older or people with certain conditions or disabilities. Whereas Medicaid is a state and federal program, work together to create a program, right? State and federal. And it's for individuals with limited income or resources. So to kind of highlight that and talk a little bit more about what that means or kind of get a visual behind that, we see the blue here is Medicare. That's the forward health insurance, or sorry, the federal, forward health, coming back, federal health insurance. That is age 65 and older and people with certain disabilities, again, federal, right? Then Medicaid, we have the federal and state program for people with limited income or resources. And then we have this kind of orange area in between where we see dually eligible individuals. That means people who are eligible for both Medicare and Medicaid and or who may be eligible and can receive services from both. All right, now this is our last slide on Medicare, I promise, and then we'll dive more into Medicaid. So Medicare, again, re-emphasizing that it's a federal health insurance program, which means the federal government regulates it and manages it, right? That means that they create the rules for it, they decide how it's run, they manage it so they can decide who's eligible for it and who's not, that kind of thing. It provides access to essential health care through several parts that cover different services, right? Like prescription drugs or general health care, your doctor's visits, that kind of thing. And it allows recipients, people who are on Medicare, to access individual or bundled parts, depending on what they need, right? So when we say prescription drug coverage, or maybe talking about Part D, right? Medicare Part D, you might hear that word, that buzzword, that means prescription drug coverage. Where we might be talking about Medicare Advantage, or it used to be called Part C, that's going to be talking about the prescription drugs as well as maybe your healthcare visits, your doctor visits, or maybe hospitalizations, right? That kind of thing. So people can kind of bundle and choose what's best for them and their needs. So now we're going to kind of get into the meat of the conversation today, which is Medicaid. Medicaid, again, emphasizing it's a federal and state healthcare program. What that means is the federal government regulates it. So, right, they create the rules for it. They create the standards and expectations for it. And the state manages it. So what that means is the state can decide who's eligible for it, who receives services, and what kind of services are going to be available to Wisconsin residents. And for more information also on what's available for Medicaid in Wisconsin, we have the A to Z. It's linked here, and it's also on your resources page if you want to look that up at some point. That explains all the different programs available to Wisconsin residents through Medicaid. So, oh, I see a question. Go ahead. Sure. Oh, interesting. Sure. How about those kind of questions? Do you have it written down? Could you write it down, or could someone over here for us write it down? I want to revisit that at the end. I think that's at least we can try to talk to you afterwards too a little bit more about that. Yep, go ahead. We can try to, we can try to get you the right person for the question you have. Yeah, absolutely. For sure. All right. Thank you guys. All right. All right. I'm going to go ahead and continue on our conversation here. So, so you hear me talk about, right, that it's a state and a federal program. What does that mean? How do the state and the federal government work together to create a set of services and programs for people in Wisconsin? What does that mean? That means that they have to create some kind of agreement, right? They have to create a document that details what is in that and how they're going to operate in the state of Wisconsin, right? So there is a thing called the Medicaid state plan. And that's going to highlight the differences or the things available that the state's going to offer. And it talks about these things I'm going to mention next, like how the state plans on following the federal rules and the guidelines, right? It talks about what services and programs the state wants to offer to its residents based on those regulations and rules. And also who is going to be eligible for certain services and certain programs, right? So it talks about what programs the state wants to offer and what services in each of those programs. So some examples of services underneath the Medicaid state plan, Wisconsin's Medicaid state plan, are things like nursing facility services or private duty nursing services. And those are going to be the more skilled nursing care and both in a facility or in your home, right? It's going to talk about home health services. It has home health services, and those are short-term interdisciplinary teams. So that could be, what that means is maybe your PT or OT, or maybe you have a personal care provider. Those kind of grouped services for a period of time. Dental services, that's going to be cleanings, right, visits. It's going to be dentures maybe, or surgical operations. Personal care services, so that's going to be things that cover your activities of daily living, like bathing, eating, and that kind of thing. Supports in that way. So to kind of give you a visual of what that really looks like, right? So the Medicaid state plan, as we've talked about, that agreement is a big list of services. You can think about it as this massive list of all these services available to Wisconsin residents, right, through Medicaid. And so as you see, we kind of created a little visual of what that would look like, right? Just a bunch of services, these little colorful circles here. So maybe mental health services, right? Or prescription drug services, that kind of thing. So it's, again, think about it as a long list of services that residents eligible can access. So how do I access my Medicaid state plan services? What does that look like for someone who's receiving Medicaid, right? So Wisconsin's Medicaid state plan services are offered through Forward Health. Forward Health, which there'll be a demonstration of shortly, is the kind of tool, right? It brings together services to create access to programs. Programs like Badger Care Plus, you may know and hear of. The Medicaid Purchase Program, MAP, as some of you may know it as. Senior Care, which is the prescription drug coverage, right? Care for Kids, Wisconsin Well Women Medicaid, and even waiver programs, long-term care waiver programs, which we'll talk about more soon. So here's another visual. We're going to kind of think about those circles, right? These services we were talking about before. So you see, you'll recognize the little prescription drug bubble, that yellow bubble, and it's in its own little basket. You'll see the other three are in a different basket, right? So think about these baskets as programs. So in a program, you'll access certain services. So in senior care, that first basket on the edge there has just prescription drugs in it, right? So that means that senior care only covers prescription drugs from that state plan, right? State plan's the big list of all those bubbles, and Forward Health helps bring together all of the services into programs, right? These baskets. So essentially we're looking at, you want to have prescription drug coverage, perhaps you want to go to senior care. If you need dental services or doctor visit coverage, perhaps you go to the MAP program, right? These baskets pulled together. Forward Health brings access to these programs so that you can get these services that you need through this card. This is where we're going to kind of talk a little bit more about what Forward Health is, because we keep talking about Forward Health and we don't have a description of what that really is or understanding, right? So Forward Health is Wisconsin's family of programs that provides access, healthcare, long-term care to a very large number of Wisconsinites, 1.5 million. And the goal is improving lives of those who are older adults who have a disability or have low income through services that improve health, increase well-being, or promote independence. And you might recognize that card in the corner that as the Forward Health card. That's the card when we talk about card services that we're referring to. I'm going to pause here. I'm going to let Kathleen come up and give you guys a visual demonstration of what it looks like. Hold on here. I'm not sure how to, there we go, escape. There we go. All right, am I sharing on the Zoom? Okay, perfect, we're good to go. All right, Kathleen's gonna go ahead and give a visual demonstration of what it looks like to use Forward Health to find some providers for members who have Medicaid.
Thank you, Kyle. I just have a couple of things to say. Forward Health, it has resources for both providers and members. The couple of the resources that are available would be the Forward Health portal, which I'm going to demonstrate how to find a provider on today. And then there's also the call centers for both member services and provider services. In your handouts, there is a resource guide. And on that resource guide, we do provide the web address for Forward Health, along with the phone numbers for both member services and provider services. So as Kyle said, today I'm going to show you how to find a provider. This tool is used specifically for finding providers who are let me say this again. It's for finding for members who need to find providers, and those members are not in an HMO. If you have an HMO, you need to reach out to your HMO to find a provider in that network. Some HMOs, actually most HMOs, do not include dental or chiropractic services. That does not mean that a member in an HMO cannot have those services. You can have those services by finding a provider through this tool and using your Forward Health card. So let's see. So yep, let's get on to the demonstration. So again, the web address up here is forwardhealth.wi.gov, and that will get you to the Forward Health portal. Over on the right-hand side of the screen, there's a link here for Find a Provider. We'll click on that link and it will take you to the Find Care page. On the Find Care page, we have multiple provider categories. The first is for medical. This is for any of your doctors, your specialists, your pharmacies, your hospitals. There's also a category for mental health. This is for mental health or substance use providers. Under the dental category, you can find a dentist or an orthodontist. And the other category, an example of a provider under there would be like your medical equipment providers. For today's presentation, I am going to focus on finding a dentist. That seems to be one that a lot of people look for. So we'll click on the dental. Under the health program for Badger Care is always Badger Care Medicaid. There is no other option at this time. The provider name or service area, there's 3 different ways that you can search. You can search by like a service area, such as dentist. You can search by if there's a specific provider's name that you want to see if they are enrolled. You can search by you would put in their last name. And you can also search by, if you're looking for a specific clinic, possibly they might be listed. I can show you examples of each of those. So for the first example, we'll go under dentist. This is hard to do one hand. Then there's a city field. I recommend not using the city field. It's optional as long as you put in a zip code. The zip code tends to yield better results. The state field, of course, is going to stay Wisconsin. However, there is a drop-down menu for the states that border Wisconsin. There are providers in our bordering states who do provide services for Badger Care Plus and Medicaid members, especially those living around the border. So you could choose that option if needed. We'll keep Wisconsin. And then I'll use a Madison zip code in the zip code. And then the last criteria here is distance. They have a range of 1 to 50-mile radius from your zip code. A larger number of providers will be yielded if you choose a further away distance, most likely. So we're going to choose the 50 miles, and then you just search. And hopefully it will come up shortly. So in this case, our search revealed 113 providers available. You get a list over on the left-hand side of the screen. There is an option here to print all the results, which will print out. You can get it'll open a new window or a new tab, and then you can print from there the list. Additionally, on the right side, you get a map, which will pin each of those providers. If you click on the pin, it will bring up that specific provider at that location and their contact information. And if you'll notice, like here, this pin has 2. That if you click on that, that means there's 2 providers at that same location, and it will bring up both of their information. And just to show you the other 2 ways to go about this demonstration or to do this search, we will go back and we can search by, I'm going to use an example of Andrew Kramer for a dentist. So his last name, and I'll leave the rest of the criteria in there and search. And then his name does come up here. So that does show he is a Badger Care Plus or Medicaid provider. If a name wouldn't be on there, then he wouldn't be seeing those members. And then the other option, again, by dental clinic. And again, dental clinics, a lot of clinics aren't enrolled. So you might not find a clinic, but they might have providers within that clinic are enrolled. So if you don't find a clinic, you may want to try a provider name at that clinic, because that provider might be enrolled even if their clinic is not. So for this one, we're going to do Bright Dental. And our search was the same criteria. And in this case, there are 2 results that come up that have Bright Dental in their name. And again, all these options do pin them on the map and have those all the same functions on this. One thing to note about these providers on this list is that just because they're on the list doesn't mean they're taking new patients. So you do have to call and verify whether or not they are taking new patients at this time. If there's no other questions, I thank you for your time, and I'll hand it back over to Kyle.
Thank you, Kathleen. Anybody have any questions? I didn't see any hands. I see somebody waiting to get into the room. Did you see that? Do you want me to admit them? Sorry. All right. We're going to change the share a little bit again here, back to our presentation. All right. And we're back. All right. So, hold on a second. Do I hide? There we go. All right. So earlier on the image with the Forward Health and all of the baskets of programs that have services in them, you probably saw the other baskets, the other programs baskets. We're going to kind of talk a little bit more about what those other programs might be. More specifically, we're going to get into long-term care waiver services and programs. So what is a waiver program? Waiver programs, also known as long-term care waiver programs, or HCBS, which stands for Home and Community-Based Services waivers, are Medicaid-funded programs that offer specific long-term care services and supports to eligible people in their homes and communities. So what makes a waiver program, right, a long-term care waiver program, different from other types of Medicaid? The big one that we got to talk about first is care in the community versus institutional care. So the whole point of a waiver Medicaid, a long-term care Medicaid program, is to offer an opportunity for those who would otherwise be institutionalized or receiving care in an institution, like a nursing facility or a hospital, but offer them the same care and ability to be provided that care in the community, right? So what we want to do is we want to provide opportunities for people to choose when they want to be in the community versus an institution to avoid unnecessary institutionalizations. Additionally, programs can decide what populations are going to be served. So you can have everything from children or adults or people over 65 or adults with disabilities, children with disabilities. There's a whole array of options programs can select to serve individuals in the state of Wisconsin or in any state. So additionally, another difference in long-term care waiver Medicaid versus other types of Medicaid would be that there are different service delivery models, or I guess this is offered in other forms of Medicaid, but we're going to talk about long-term care delivery models and flexibility available in that. And then also one big difference in long-term care waivers is the long-term care services that are provided versus the state plan services, those forward health card services you might be familiar with. So long-term care services specifically is referring to things not available in the state plan that help you remain in your community, right, and getting care in your community. And we'll talk more about what those are and examples of those in a little bit. So examples of long-term care waiver programs, children's long-term care supports, you might have heard of that, CLTS, IRIS program, the family care program, and family care partnership. Those are some examples of ones available in Wisconsin. We're going to talk more specifically about two examples of adult long-term care programs. Those long-term care waivers that you guys know as family care and as IRIS. We're going to talk about them because they're kind of the two big ones that are often selected in the state for adult long-term care. And we're going to talk a little bit about the service delivery models available between those. So family care is a managed care program and offers members case management and care coordination, as well as some opportunities for self-direction. What'd you say? Oh, sorry. Okay. Additionally, they are administered by managed care organizations, or MCOs. IRIS, then there's the other program we're going to talk about, IRIS. It is a self-directed program, and it offers participants budget and employer authority to self-direct and manage their own services and their care. This is administered by two different entities known as IRIS consultant agencies, ICAs, and fiscal employer agents, FEAs. So those are some of the big differences between the two. Now we're going to drill down more to the IRIS waiver program, and we're going to kind of talk specifically about what's available in IRIS, that structure, the service delivery model, and that kind of thing. So the IRIS program stands for Include, Respect, I Self-Direct. It is a program for adults with disabilities and people over 65 in Wisconsin. It is a self-directed program, which means that participants have the freedom to decide how they want to manage their services. To enroll in the IRIS program, there's a couple different eligibility requirements, which include being 18 years or older, being eligible for a type of Medicaid, meet non-financial criteria. What that means is being an eligible population. So IRIS again serves those individuals, those adults with disabilities, and people over 65. Additionally, meeting a level of criteria, level of care, a required level of care. And that's kind of a term of art. But what we mean by that is going back to the institutionalization. Remember that we're trying to offer opportunities for community care in the community and access to the community instead of institutionalization, and making sure we're offering those to people who would otherwise be institutionalized. So that level of care being what would be provided to you if you were in a hospital, right? If you're at that level of need, right? Residing in an eligible living setting is another criteria. And to know more about kind of what that means or what any of these criteria mean, there's also a link on the resources page and on here to the IRIS webpage, the DHS webpage, which has more information. Now we're going to kind of drill down to the IRIS service delivery model and kind of talking about its unique, the elements of it that make it unique in Wisconsin. So the IRIS program was developed as an alternative service delivery model to the managed care programs in Wisconsin. If anybody knows the history, it was 2009 and projected to be about 400 participants, and it's grown to about 26,000 people, I think. So a lot bigger than expected, but evolving every day to keep serving Wisconsinites. So IRIS is a self-directed service delivery model. And what that means is it offers participants budget and employer authority. Now I've got some definitions of what those mean here. The first being budget authority, meaning participants have the decision-making authority over how Medicaid funds in their budget is spent. So what that means is they, based on long-term care needs for their unique individual plans and needs, they get to determine what services best meet those needs for them, right? Within the realm of what's offered in IRIS. They can determine that if a personal, a provider, an individual is a better substitute than a piece of technology, they can decide that. That's how they have budget authority, right? Employer authority means that participants have decision-making authority to recruit, hire, train, supervise their own staff, right? Who provide their services. That can mean that you choose to hire an agency to provide your services, or it can mean that you choose to hire your brother, your mother, your cousin, neighbor, anybody in your community who is willing and able to provide services to you that would benefit you and meets criteria, of course, your criteria that you set, as well as background checks. If you want to know more information about self-direction at the federal level, the definitions I provided here are from CMS, which is the Center for Medicare and Medicaid Services. There is a link on the resources page and also here that could take you there. All right. So what services does IRIS cover? What does that mean? What is an IRIS waiver service? We refer to those, that's what I've been referring to as long-term care services. So long-term care services versus state plan services, right? Long-term care services include things like support services. So support services might be supportive home care, if you've heard of it, which would be providing you perhaps some chore assistance or companion care if you need someone to be in your home with you and take care of you through companionship. It could include things like community transportation. If you have a neighbor who takes you to work, right, and offers you transportation that's accessible to you. It also could include living situation services, and that might be something like housing counseling, right? So maybe you currently live in an AFH, but you want to live in your own apartment, and you want to know if that's feasible for you in terms of your budget or in terms of your community and access to the areas around you that you need to be. Housing counseling can assist you with that. Additional living situation services could be adult family home services, so 1 to 2 bed AFH or a 3 to 4 bed AFH. Perhaps you would like services from one of those provider types that's under this. Sure, yes, thank you, thank you. All right, so then another example is aids, equipment, and supplies. Some examples of those services would be things like assistive technology. So perhaps you need a communication device to help aid you. That could be an example. Another example of aids, equipment, or supplies would be a PERS, a personal emergency response system, PERS. And that one could be things like Life Alert or even the Night Owl system to help monitor safety overnight or bed alarms, that kind of thing. And then additionally, things like employment services. Examples of employment services would be things perhaps like supported employment. It's like on the job coaching or supports to help figure out what jobs best suit you. It could be things like day services being things that'll provide you community access and fill your days with developing skills to further manage or develop maybe job or retirement or personal endeavors, that kind of thing. So those are a couple services. It's a very long list. And if you want the exhaustive list, the whole list of services, the IRIS service definition manual is linked here and also in the resources page. So my last little slide here before we get into some questions and our activity is a visual to explain kind of the difference again between state plan services and the waiver services. So we're going to start with IRIS. You'll notice there's just the one blue dot next to IRIS. That blue dot stands for the Medicaid waiver services. Those are things we talked about just now, like supportive home care, maybe home delivered meals or employment services, right? And those are going to be specifically covered by the waiver. You'll see family care has the blue and the yellow dot. The blue dot standing for those waiver services, again, the supportive home care, that kind of thing. And the yellow dot standing for card services being the home health, nursing home services, personal care, that kind of thing. And family care covers both of those realms. Whereas IRIS covers the blue dot, and then people access the yellow services through their card services as a separate set of services. We won't talk about partnership, although partnership covers all of them down to the green, which is hospitalizations, et cetera. And that's another extension of a family care program. So with that, I'm going to pause here. I'm going to take a little time to answer some questions. And then I'm actually going to allow Rosie a chance to give her story. She's got quite the life and the advocacy experience, and she's going to tell us a little bit more about what it means to use Medicare, Medicaid, and waiver services to build a plan to support you in your life. So before we get into that, any urgent questions people want answered? All right, Rosie, you're up.
Okay, it's kind of interesting because I see myself in a lot of different circles here today. And first of all, remember the circle where we had Medicare and we had the Medicaid, and then there was the kind of tan spot in the middle. That is where I live part of my time because I am in that tan spot. And one of the reasons I'm in that tan spot is because my regular health insurance decided that because I had so many medical bills and I had exhausted my 401k. I had spent that. I had spent all of my savings. I was down to zero amount of money. I then became eligible for something called extra help. And that extra help put me to have not only a Medicare card or a regular Medicare insurance, but then a secondary forward health card that covers things like the prescriptions or some other things that I might need. So I fall into that. And then shortly after I became eligible for that extra help is when I found out about Iris. Now, my story began back in 2009. And the reason I thought I'd never be in this situation in my life. I had a very good job. I was, I was very self sufficient. But in 2009, I had a knee replacement. About 2 weeks after my knee replacement, I developed a MRSA staph infection. That MRSA staph infection led to 58 surgeries, over 200 hospitalizations. I have been in septic shock more than 14 times. I've had over 100 blood transfusions. I've had 3 amputations and also skin removal all the way to my waist. So if you see me sitting kind of this way, I don't have much of a butt to sit on. So I kind of lead to my left side because of that. It took me from 2009 until 2017 to close the wound from that initial surgery and all the repeated surgeries. So even, no matter what they did, it just kept happening. And that's why I ended up having more and more and more medical expenses. And, even when you go, I started out with, I wasn't eligible for Medicare yet at the beginning of this. I started out with disability, but even on disability, you spend almost 2 years on, I think it was 2 years that I had to provide my own insurance. And so first I covered my insurance from my job for the first 18 months. Then there was a state insurance, which was a very high insurance every month, plus a high deductible. Then there was a state insurance at that point. I took the state insurance and spent, I think maybe 4 or 5 months on that state insurance, and then it went away. So then I had, paid off the deductible on that. And sometimes I could go through the deductible in a day because when you're on very high IV antibiotics, $5,000 a day is a drop in the bucket. $10,000 a day is a drop in the bucket. And so, when people talking about the donut holes, I would go in and out of the donut hole within a matter of hours sometimes. And so then I ended up on another insurance. So in 1 year, I paid 5 and 2 $10,000 deductibles besides paying copays. And so that's why I ended up on the extra help. Along the way, we were pretty much financially devastated at this point. We had, we were down to our last pennies. My husband quit his job to help take care of me so I could continue to live at home. And I have to tell you, nobody in Wisconsin told me about Iris and about what could happen in Wisconsin. But my sister lived in Michigan, and a friend of hers went on a program in Michigan that was similar to Iris. And she said, we were devastated, but because now my husband can get paid for caring for me through this program, it's helped us out and we're not as devastated as we were. And so my sister said, my friend says there's a program in Wisconsin. So I started doing research and I found the IRIS program. And I, started working through the IRIS program. And, at first I had to jump through a lot of hoops, but I'm going to tell you that the hoops were worth jumping through. It was worth doing it. It was worth getting involved, because not only did I get the supportive care I needed for my husband to be my caregiver, and I fall not only in the blue dot, but I also fall in the yellow dot. And so I fall in both those dots. But I not only, in 2020, I lost my husband very quickly to cancer within a month. He ended up being diagnosed with terminal cancer, multi-organ terminal cancer. And so within a month's time, he was gone. And now I didn't want, I'm a very active woman who do a ton of patient advocacy work across the world. And I didn't want to be in long-term care or to be in assisted living. That was not my game. And, but my daughter and daughter-in-law had been a backup to my husband for some things. And so they picked up his part of his role and is doing a lot of the things for me. One of the things they right away picked up was transporting me to doctor appointments and things. And at first, for the first year, first of all, I didn't have a power chair at that point. I only had a manual chair because my husband didn't believe in getting a power chair. He was my VIP, my very important pusher. I mean, that's what people would call him at conferences. That's what they called him, my VIP, my very important pusher. And so he never wanted me to get a power chair. So I didn't know that I could even work through IRIS to get a power chair. But so I worked through Medicare and Medicaid to get the power chair. But all of a sudden I had this power chair and now I couldn't get transported anywhere. And I kept looking at the vans and I'm like, I can't afford these vans. I can make the car payment for the car I have. And I could probably trade that car in, but I can't make a car payment that's 3 times as much as what I was making. And I'm on the board, and all of a sudden this policy shows up. I'm looking at, and they're talking about this policy for transportation modifications. And I'm like, well, wait a minute. That's what I need to do. That's what I need to do. I need to get a van that's modified so that I can use my power chair, so that I can. And then I realized that I hadn't driven in 10 years. But one of the things that many people don't realize is that up till 15 years after you stop driving, you can still get your license back. So I then went to the DMV, got a temporary license, because good old IRIS, after jumping through a few hoops again, got my not only got me a van, but got a van where this wheelchair locks in to the driver's side and I can drive from the wheelchair. I'm one of 2 people licensed in the state of Wisconsin to drive with my left leg. So I don't even have hand controls. I drive with my left leg. The reason is because I'm amputated so far up that I can reach over. We didn't have to move the gas pedal or anything. I can reach over. And because my brain has been so reorganized to think about driving with your left leg, rather, because haven't had a right leg in more than 12, almost 12 years. So it's changed. My brain has changed. And so my doctor wrote a letter to the DMV and said, I think she can drive with her left leg. And they took it. But I had to prove to the DMV that I could drive with my left leg. So I'm now, this happened, and I was 60 years old when this happened to me. I'm now 74. And so last year at 73, I took a behind the wheel driving test in pouring rain, but I got I got my license back. I'm full and able to drive with my left leg. And but I also can, have other people drive. So you can take the seat in and out. You can move the passenger seat to the driver's seat. So like, even if I decide to start driving and I'm like, wait a minute, I can't do this. If I've got a passenger with me, we can move the seats back and forth. But I don't drive long distances, but I go to my doctor appointments pretty much by myself. I go to church. I go to family functions. I go to breakfast with friends. I do things that I want to do because I can again. And I don't have to say, hey, Michelle, would you take me? My daughter-in-law is here with me. Could one of you take me from the family? And that's what I had to do the first year. And I don't like being a burden. I'm an independent woman. I've always been an independent woman. And so that, all of these programs are extremely important to me. And I have to tell you that, sometimes people might say, I had to jump through all these hoops and I don't understand why it's this hard. And why do we have to do all these things? And I'm going to say, I work with other states and I now do some consulting with other states about programs because they're starting programs like IRIS in other states. We've learned a lot in the state of Wisconsin. The hoops aren't as big as they were even in 2016. And we've tried to, improve things. People are now talking about EVV. Now, you have to remember that EVV is a federal program. It's not something that the state of Wisconsin decided to do to us. It's a federal program. And so, I tried to petition the feds. I do work for CMS. And for Medicare and Medicaid. And I tried to tell them that this is a hardship on people. But yet, they didn't hear it. I went to our representatives, state, and the senators, and it didn't go away. But at least they heard us. They heard what's going on. But the state of Wisconsin has, tried to make it as smooth as possible. They're trying to work with people. I have to say that I know that many times people get frustrated. I'm going to tell you, the frustration in the end is worth it. And I have, many times people say, well, I can't understand why they make me do this, why they have to do this. I have to do this. And I'm saying, you might have to jump through hoops, but on the final day, it's worth jumping through the hoops. And, in order to get this chair, I jumped through a ton of hoops. And now I look at it and I'm like, well, I could have probably gotten through IRIS, but I didn't know it at that point. And so I went through Medicare and Medicaid and I jumped through a ton of hoops. And so it took me a full year to get the chair. So, it's not always easier on the other side either. So I'm just saying that let's be appreciative of what we have. Let's be supportive. But if you have problems, there are tons of people that will reach out and help you. There's the Busmans, there's people like Kyle and Leon and people like that who are Christian is here. I mean, they're willing to help you. Ask the questions, they'll get to the questions to the right person. I think Kyle's going to give it back to you.
Thank you, Rosie. All right. I don't have much more but an activity to do. Oh, yeah, absolutely. Perfect time.
No, and let's just, for lack of to not alienate the other program, you didn't know about the waiver programs in Wisconsin. Did you not? So my question is, how did you become aware? Was the ADRC something that was not part of your landscape? How did you? So what do you think we could do to improve that? Because I'm going to guess many people in Wisconsin are unfamiliar with the waiver programs because they may be unfamiliar with the ADRC. Would you say it's fair? And what could we do?
I mean, part of it is word of mouth. It's people like me getting out there and talking to, patients who or participants who might be saying, I'm struggling and I don't know what to do. And, and people call me and say, how did you get into this program? What did you have to do? And, and I try to encourage them to not get frustrated because you have to jump through some hoops. But let's face it, no matter what you do in life that's worthwhile, you sometimes have to jump through hoops. And, especially when it has to do with government programs. And I think Amy said this to me before we are an example. We have learned a few things in the state of Wisconsin about, and your website. My whole theory is the things that Kyle's put together for this, I believe should go on the website because the website's kind of confusing. And this is much clearer. And the reason I have asked Kathleen to be here, and I was the person who said Kathleen needs to be here, because I had gone on the website and I thought, because Chris asked me for questions and I'm like, I don't exactly know all the ins and outs either. So I went on the website and I got more and more confused on the website. And then I asked, when Kathleen said she was from Forward Health and she answered some questions for me, I'm like, okay, here's, let's put this together in a way that people can understand it simply. And then my whole theory is it needs to be on the website. It needs to be there so people can understand it in a simple form.
Thank you, Rosie. Any other questions?
Hi, I'm Lynn from Appleton, Wisconsin. The question is that $300 grocery card. I was told I had to be on Medicare, but I have other participants that I work with that are getting this, excuse me, this card through the government. They're on food stamps. How come at 52 years old I can't get that? I mean, I just don't understand why I'm told I can't get that food card.
Yeah, oh, there you go. Rosie said she can't either. I'm actually interested. So food share is a Medicaid program. So that's worth noting. But obviously if it's Medicare has an age point. So I think it's worth we get your information and more about what you're talking about. We can maybe get back to you via email or something. Yeah. Any other questions about the presentation or anything? Oh, sorry. Oh, thank you. All right, here you go.
I know this is about what IRIS covers. You mentioned a web page. Maybe you could give a link to that. But then secondarily, a little bit more information to help people understand the difference between eligibility for family care versus IRIS, because it sounds like there's a lot more doors open if you can get into the IRIS pool than if you're in the family care pool. So speak to the eligibility on those two. Thank you.
Sure. Yeah, absolutely. So there is a link to DHS's IRIS web page on the resources guide and links guide. It's towards the bottom. Actually, flip the page. My bad. It's right there. So it will be provided digitally as well. It should be on the website. If it's not already, it will be. But to answer more about the differences in eligibility between the programs, there's actually not a lot of differences. So the differences in the programs aren't the service packages. For the most part, the benefits are the same. The services you could access are almost the same. There are some slight differences, but it's primarily the same. And eligibility for the programs are almost identical. They're the same groups of people served. You have to be eligible for Medicaid in both programs. You have a certain age to be eligible. There are very minimal differences between the eligibility groups for each program. The biggest differences are whether or not you need care coordination and case management. So if you're looking for more coordination and case management and more assistance in that way, that's family care has a lot more of that offer within it. Whereas Iris has the ICAs and they provide consulting services and they help you kind of guide you through the long-term care program, but they don't case manage and coordinate for you in the same way that MCOs do. So the biggest difference is that, and being managed care, being that they provide care coordination and case management, they do provide STS services. There was a great presentation yesterday on that. So some services within the waiver, a pretty lengthy list actually, is provided via the STS or self-directed services model. The only major difference is that Iris, all of the services are self-directed. There are none that are case managed in any way or care coordinated. But there's a lot of flexibility within that. Yeah. Correct. Yep. Yeah. Correct. So she was, yeah. For Zoom folks, what she was saying was that the biggest distinction, or that people often switch between programs. That's very true. People do go back and forth because not everybody, some people want to self-direct and they realize that that's not the best solution for them. Or some people want to self-direct with case management as well. Some people want just case management, and there's all the arrays between, but that the best solution, obviously the only solution, the only way to get into a long-term care program is to go through your ADRC, your local Aging and Disability Resource Center, or if you're tribal member, the ADRS, Aging and Disability Resource Specialist.
Since it sounds like many of these services are county-based, what happens to someone when they move?
So the programs are statewide, and all of the services are available to all members in both programs. However, each county may have different ICAs, FEAs, or MCOs available in them. So it just depends on who you want to manage your care and who you want to consult, depending on the program. So that's the biggest difference. Individual services, like transportation, that kind of thing, can vary depending on providers in each county, right? So that's where the variation is. Any other questions?
I have two questions. First question is, so one thing that not everyone knows about me outside of is that outside of my traveling work, in the state of Minnesota, under their Department of Health Services, the state of Minnesota offers an alternate housing arrangement for people with disabilities known as adult foster care. And I actually have a license that was granted to me to be able to do tech support work at an adult foster care facility in return for being able to spend the night whenever I travel to that area for my self-advocacy work. Is adult foster care a service provided by the state of Wisconsin Department of Health Services?
So I wonder what the definition of that would be, because we offer adult family home services, but we don't have anything called adult foster services, foster home services.
It is a service wherein adults with disabilities, along with children in the foster system who are disabled, who have turned 18, can actually stay within a residential home with a designated state-approved foster parent and get care as if they were in a group home, but they live inside a residential community.
Interesting. I don't know if we have anything quite the same. I don't know, Amy or Leon. Right. The foster specific piece and the foster parents, I guess maybe that's what's tripping me up a little bit. Because are they like legally fostering them? Like they're fosters, or are they just? Sure. Okay. Okay. Yeah, it kind of sounds like adult family home, but it's a little bit different. Hold on. Okay. I'm seeing somebody is explaining that adult family care is, or sorry, adult family homes are the same as adult foster services.
So you mentioned, self-directed care, and I actually have had to de facto do a lot of self-directed care for my own health because I have a lot of health issues that actually were treated by a lot of alternative medicine because of autism comorbidities that required special treatment. And I have to pay for a lot of that care because it's so new insurance refuses to cover a penny of even the medication I rely on to function. So what are the lines of, what are we going to cover versus not for people in my situation who already are relying on healthcare that regular insurance companies refuse to provide?
That's a great question. And I'm not sure I'm the person to answer that. That kind of branches into the realm of the Medicare and Medicaid side. And I have enough knowledge to share that they are separate programs and what requires each. But in terms of prescription drugs and access outside of long-term care services, I'm not sure if there's any, or Leon, if you have a better answer to that question. Yeah. Yeah, so we could take that back as a question if you. No, it's okay. That's okay. We're all learning here together. So. Wow, it's great to know though that we have up and coming things that are worth noting. Well, thank you for sharing though. Rosie, oh, perfect. I'll run you.
I guess when I look at the difference between, back to the question about the difference between family care and Iris, for me, is I want to have a little more control over my life. And that's why, and when it was originally explained to me, and I remember the woman coming to my house and explaining to me, I want to have control over who I hire and my budget and those kind of things. But I do go between the two because I do have some personal care, and that comes under the family care, I think. I, I don't know exactly how that comes together, but I, and the other piece is that, not only do I get have the van, but I also get mileage. So I can be reimbursed for mileage. Now you can either get appointment or transportation to activities or to health, to appointments and things. I can get mileage for doctor appointments. And for me, because I live in Chilton, Wisconsin, and many times I have to go to Milwaukee or somewhere near Milwaukee, that's like 150 miles round trip. That makes a difference. It may not be the federal amount of money, but it makes a difference. I laugh because you turn in your sheet, and I turn it in like every time I get 6 rides that I turn in my sheet, and all of a sudden I get a text message, and then it pops up in my checking account, and it's like my little bonus in life to get, because I've already paid for this gas, and now I have a treat that I get some money back. But those are those kind of things that we don't always talk about in Iris, but yet, or in the programs, but yet those are important to people who live on a fixed income. I do a lot of work with CMS and Medicare, Medicaid around the social determinants of health. And those, and they have named 4 of them, and that is housing, transportation, utilities, and food. And sometimes people have to make a decision between medication and food. And I would have to make that decision sometimes if I had to pay for prescriptions or if I had to pay for all of the transportation. I would have to sometimes make decisions between food and, or at least healthy food and transportation. That's the real life.
Yeah, thank you, Rosie. That really highlights kind of how Medicare and prescription drug coverage can support your long-term care plan, right? And the services that you need within that. You have more freedom for your own funds to cover your own, your healthy food, for example. All right, any other questions? Oh.
Didn't want to make you feel like you traveled here all this way for nothing. You mentioned that Medicaid is a gateway to eligibility for family care, Iris. any kind of Medicaid, or is there, because there's lots of different Medicaid programs. So how do you find out which ones yes and no?
That's a fantastic question, and it's very lengthy. I'm going to give you the short version. There's a lot of Medicaid types that make you eligible for long-term care waivers. In both Family Care and Iris, I think it's almost exactly the same list, if it's not very close. And the types of Medicaid just depend on how you're eligible. Most types, like full benefit Medicaids, those are going to make you eligible for both programs. There's a lot of links out there that get really hairy and messy. So there's more of like technical guides and things like that that kind of go through that. But what you would need to know is that full benefit Medicaids are the types that get you into long-term care programs. That could include things like a long-term care Medicaid, regular Medicaid. I believe Medicare Plus is a full benefit too if you're eligible. So that kind of stuff. It's a very long list, but I can also provide that if you're interested. If you want to know more, I can get your email and provide you that list. Yeah, of course. All right, I think we're going to start the game here. We're going to hand out 2 cards, a red and a blue one to each table. Every table is a team, so you got to work with your teammates. And the gist of what we're going to do is we're going to ask the whole room whether or not they think a certain service is a long-term care service, like a waiver service, like Iris or Family Care, or et cetera, or if it's a state plan service, so that forward health card service. Your whole team can vote together. You guys talk about it. We'll leave you time to discuss and decide. And the one with the most cards gets first pick of the candy bucket over there. We'll go through a test run with it once everybody has their cards. Oh, sweet. Sounds like everybody's got them. All right. For those who are on virtual, feel free to put in the chat what you think, if it's state plan or waiver service. But yeah. So you guys will see 2 buckets in front of me, or 2 baskets, a blue and a red folder. A red folder is going to be long-term care waivers. I know it's kind of hard to see over the projector and stuff. Red is going to be your waiver services. And blue is going to be your state plan services. So again, state plan being those forward health card services. If you remember the visual from before, I'm going to show you quickly because there's some cheating on there. It's the blue here is the supportive home care, et cetera, right? And then card services again are things like, nursing home, personal care. So I don't want people cheating. I suppose there's enough candy for everybody regardless. But red, yes, is long-term care, those forward health or the Iris, et cetera. And then blue is going to be state plan. So I'm going to hold up a card and then you can deliberate with your team. All right. First one is day services. So the definition of this would be that it's a regularly scheduled activity provided to people in the community intended to build and develop desired life skills. Some examples might be training and support to develop health, self-help, or social skills. What do you guys think? I'm seeing a lot of red. Has everybody voted? All right, you are correct. It is long-term care. Nice job. Off to a good start. We didn't even need a test run. It was perfect. All right, the next one is hospice care. This is going to be near end-of-life care focused on comfort and quality. Nurse visits, equipment to ensure comfort, like a hospital bed or oxygen. I'm seeing some blue. I think everybody, oh, blue. Okay, we got it. You're all right. Hospice is a state plan service. All right. This one is respite. Services provided to offer a person's primary caregivers a designated period of rest. All right. I'm seeing a lot of red. You're all correct. It is long-term care. We don't even need to play. You're all experts. Non-emergency medical transportation, NEMT. This is medically related accessible transportation services. It would be accessible rides to your medical provider for annual wellness visits, for example. Oh, and I'm seeing some blue and some red. Ooh, this is the first kind of hot one. It is actually, it's NEMT, it's not medical, and it is a state plan service. Good try though. All right. Prosthetic devices or prosthesis. Devices to support, replace, or improve function of a body part. For example, a prosthetic foot or ankle or silicone arm prosthesis. State plan or waiver. All right, I'm seeing blue all around. That is correct. It is a state plan service. All right. Supported employment. This would be individualized employment support to obtain and maintain preferred employment. And everyone's already going. Everyone is correct. It is long-term care. If you don't want the definitions, I don't have to give them. Looks like you're all experts. All right. Physical therapy. Does anybody want to? Nope. All right. Perfect. It is, in fact, a state plan service. Personal care services. This might be a little tricky. Support provided to a person's home to support them in activities of daily living. Assistance with bathing or eating. I'm seeing some red. I'm seeing some blue. It is a state plan service. It is blue. Community transportation. Accessible non-medical transportation. This is an important one. It's non-medical transportation provided in someone's community. This is like rides to a social event or your place of employment. Correct. It is a waiver service. See, I got experts in here. Private duty nursing services, ongoing skilled nursing in a person's home, tube feeding, medication management, catheter placement, that kind of thing. I'm seeing mostly blue, little bit of red, got a combo. All right, it is a state plan service, blue. Yeah, in family care. Yep, correct. Yep, this is a little bit more IRIS specific. So these are long-term care services. You technically do have a difference in your waiver, specifically in long-term care waivers. They will specify where it's different. We're getting kind of high level here, but yes, you're correct. But in IRIS, is this a long-term or a state plan? It's assistive technology, piece of equipment or aid that increases or maintains or improves the person's functional capabilities. That is correct. It is, in fact, a waiver service. All right, home delivered meals. Any thoughts on that one? That is correct. It is a waiver service. The last one was home delivered meals. It's a waiver service. Yep. All right, housing counseling. Maybe you heard me mention it earlier. So services to help a person obtain affordable, safe, and accessible housing. That is correct. It is a waiver service. All right, dental services, oral services provided by a dentist. That is correct. It is a state plan service. All right, nursing facility services. Any guess there? Yes, it is. It is a state plan service. We're getting down to the wire here. I think I got 4 left. Vehicle modification. This one was a hot one, just talked about. Is it a waiver service or is it a state plan? Correct. Waiver service. All right. Lab x-ray services. Yes, it is. It is a state plan service. Residential services. This might be AFH services. So going back to that adult foster family, right? Our foster home. So adult family homes in our state. Yep, it is a waiver service. All right, last one, supportive home care. Nice, correct. Oh, we got one more team waiting to vote. Yep, you're right. All right, it is a long-term care waiver service. All right, thanks everybody. That was the game. Yeah, go ahead. I don't know if anybody was. Yeah. Yeah, everybody that was almost unanimous every time. We're going to pass around the bucket. It's some good candy. Anybody who wants it. Any other questions before we wrap up? Yeah. Yeah. Anybody who has any questions that they wanted to bring back to us or want us to get your email, come up here. All right. Thanks, everyone.